old. Mike was doing some roofing and has fallen about 3 metres.
Our NHS provides an exceptional service and is there for all of us when we need it most.
Ready, steady, lift. That's great.
The emergency department at Dorset County Hospital is currently under immense pressure, serving more than twice the number of patients it was originally built for.
We did have some obvious deformity on his left femur.
Hard-working and dedicated staff is still continuing to provide excellent care and meet the huge demands on this service, but change is needed. The hospital's new fit-for-purpose emergency department and critical care unit will transform the hospital's capacity, improving access to life-saving emergency and critical care facilities and state-of-the-art medical equipment. These modern clinical facilities will benefit patients for generations to come.
I started here on intensive care at Dorchester around about 2008. I remember a guy who was in his 60s and had come to us with an exacerbation of a very chronic condition. It became clear very early on that we were not going to be able to save his life, and what we moved towards instead was as dignified and as comfortable and as supportive a death as possible. He was obviously very sad that this was going to be the end of his life. He was worried for his family, he was worried about the impact it would leave on them. But his one real wish for him was that he wanted to die outside. He felt that that would enable him to feel calm and at peace at the end of his life. We've got a very small conservatory on the side of the unit. It's full of kit because we haven't got a lot of storage space at all at the moment, so less than ideal. What I then did was cleared the conservatory out. We sourced some screens to make it private from other patients, and we managed to wheel him out there and withdraw care in the conservatory with his friends and family around. And yeah, he died a very peaceful death. It was a very fulfilling moment as a nurse, but I remember just thinking it should be better than that. We should be able to do better. This is the end of someone's life. It's a big deal. The Winter Garden will just make a huge difference to patients like that and their families. It will mean that it's more an everyday occurrence as opposed to the extraordinary. It becomes the ordinary and it just becomes everyday business as usual. This is the standard of care that we can provide for our patients and our families, and I just find that so exciting. The Winter Garden really will just change the whole face of care delivery for our critical care.
The condition I'm being treated for is paranoid schizophrenia. I describe the feeling of paranoid schizophrenia very scary, and I hear voices and the voices are really nasty. They don't say nice things at all.
I knew from the time Hattie was 8 that there was something seriously the matter.
And you had 8 years continuously in hospital before you were able to move back to Dorchester, where the nurses and the doctors were really kind and treated you with great respect, didn't they?
Yeah.
Which was such a change from what you were used to.
When I come in this hospital, I don't think, oh God, I hate hospitals, or I don't like coming here. I feel quite safe here. If the CAMS team had been there when I was in hospital, I think things would have gone very differently. I don't think I would have been in foster care as much or hospital, or it would really have helped if they'd been there when I was there.
My mum had been diagnosed with ulcerative colitis in 2015. She managed it with medication and diet, and she seemed well within herself. She'd been having some sickness, she'd been having, bug-like symptoms, and we said, it was January, we thought, well, this is probably just a winter bug. One morning, my dad came upstairs and she was lying unresponsive on the bed. He phoned 999, performed CPR on her, and she was taken straight to DCH. They said to begin with, they suspected that she'd had a heart attack. They said she had significant brain damage on top of everything else. They advised us they would take her to critical care where she would be ventilated. My mum was only 62 years old, and they said, she's quite young and we want to do everything we can to help her. We were put into a relative's room, and this relative's room was small. It had 2 sofas in there. It also had a filing cabinet in there and a very, very small window. And every time that somebody came into that room to deliver us more bad news, and the news did just get worse and worse, and it's unimaginable news. It's news that you never want to hear in your life about somebody that you love very much. So Mum was admitted at 8:30 in the morning on Thursday morning, and she had passed away at 8:30 in the morning the following day. And whilst a room is just a room, and it wouldn't have made the situation better in terms of the outcome for my mum, that room is part of my memory and my family's memories for the rest of our lives. And I remember feeling very trapped, very claustrophobic. So I believe that relatives accommodation is incredibly important. It needs to be a space that is comfortable, it can give you some level of comfort in a time in your life which is incredibly scary, incredibly stressful and traumatic. And whilst a room can't make it better if the outcome is not good for a loved one, I do believe that having that space can make it easier.
The new emergency department and critical care unit will transform the experience for patients, their families and friends, and our staff, providing the best possible care and support for those facing distressing situations. Dorset County Hospital Charity is raising funds to help transform healthcare and raising money beyond the NHS budget to pay for those extras which make a positive difference to patients, staff and our community. Together we need to raise £2.5 million to fund new facilities to support patients and staff in the new emergency department and critical care unit at our hospital. Every day in the NHS, lives hang in the balance. Your generosity can make a real difference to the lives of those facing urgent medical needs. With your valued support, we can provide state-of-the-art medical equipment and help make life-saving emergency and critical care facilities at Dorset County Hospital the best they can possibly be. Please will you help us support emergency and critical care together? Thank you.